Welcome to my channel. Right now, I will be addressing possible causes of secondary hypertension. By definition, secondary hypertension is a form of hypertension or high blood pressure that is caused by another disease or another condition. This is different from hypertension or high blood pressure without a known cause. That is known as essential hypertension. The essential hypertension is the commonest. The secondary hypertension is not so common. Secondary hypertension is just about 10% of all cases of hypertension. You can suspect that this is a secondary hypertension if this patient is young and he or she is presenting with high blood pressure. The first on the list will be renal system. Renal artery stenosis will lead to secondary hypertension, meaning there is high blood pressure, but we now identify the cause that there is problem with the kidney. And here we can have renal fibromuscular dysplasia in young patients. In elderly, it could be renal atherosclerosis. It could be glomerulonephritis. Might be Nephrotic Syndrome. It can be Nephritic Syndrome. The hypertension might be secondary to problem with the thyroid gland or the parathyroid gland. So, in thyroid disorders and hyperparathyroidism, we might be dealing with hypertension today. The problem can be within the adrenal gland. There are many things that could happen there. Here, we might be faced with Cushing's syndrome, and that will mean that there's excess cortisol level. It might be fibromuscular with excess epinephrine and norepinephrine. It might be Cone syndrome with excess aldosterone leading to fluid retention because sodium will be retained and potassium will be low. It might not be any endocrine gland or kidney. It might be as a result of obstruction. Obstruction where? Okay, it might be sleep abnormality with obstructive sleep apnea. Can be as a result of coarctation of aorta. Might be secondary to so many different medications, from street drugs like cocaine, to non-steroidal anti-inflammatory drugs that could retain water, to tricyclic antidepressant with horrible side effects on cardiovascular system. Might be steroids that could jack up the blood pressure, or the decongestants or sodium tablets that will retain water. Can be as a result of side effects of cyclosporine, tacrolimus, or erythropoietin. And lastly, on my list is bevacizumab, sunitinib, or sorafenib, methylphenidate, alcohol or atypical antipsychotics, and amphetamines. Amphetamines, some will argue, should be under the street drugs. You know what? You're not wrong, but you're not right. You're not right because amphetamines are actually prescribed, but people took it from the pharmacist, after being prescribed by doctors, and then started abusing it. That's why you find it on the street. With that, I've come to the end of this very presentation. Remember to share this very presentation. Remember to subscribe to my channel so that you can get all my presentations immediately they're published. So anytime a young man, young woman, 25 to 35 or early 40 is down with hypertension, we tend to look for the cause. Thank you.